Yes, once you send it to me, I will post it to my Facebook page. But hello, everybody. Thank you all for attending. We're going to get started in a few minutes. And Miss Smith, did you say you were on the A&M student health page right now?
I'm recording for Zoom right now, and I'm
Okay.
getting ready to post it. We'll
Okay.
start the live.
Gotcha. Technology is on our side today.
Yes, indeed. Okay. It's connecting now. I'll let you know when it's began. All right, we're ready.
Yes, okay. I see it. I'm about to share. Cool. All right, I have it shared on my page. If any of the panelists would like to share it on their Facebook pages or social media pages, please feel free. And Ms. Smith, if you have anything for student health and wellness that you want to go ahead and leave with, you can, and then we can keep going.
Okay. First of all, we want to thank you all for joining us for this very important conversation. Thank you to our students, our faculty, our staff, our amazing professionals at Student Health and Counseling. We appreciate all that you do. So we welcome you to ask questions, have dialogue, and we will do our very best to get your questions answered. Thank you for joining us today.
Thank you, Ms. Smith. Welcome, everyone. My name is Obrenka Thompson. I am the Director of Health Education at Thrive, Alabama. As Ms. Smith said, this is another installment of Thriving Thursdays, and today we will be talking about discussing your physical, mental, and social well-being during COVID-19. So as the title says, and it doesn't stop. So it's so much going on with COVID-19, and we just wanted to create a space to continue to talk about everything else that's going on outside of COVID-19. So like I said, I do work at Thrive Alabama as a director of health education. Thrive Alabama is a community healthcare clinic, so we offer primary care and pediatric care as well as behavioral health services, wellness services to the greater Huntsville area in North Alabama for those who have insurance and for those who do not. You can come to Thrive Alabama and we will work with you to make sure that you get the best help that you need for your best health outcomes. Um, with that being said, I would like to go ahead and introduce our fabulous panelists today. I would like to begin with Miss Esophia Claiborne. She received her bachelor's in psychology and her MSW from Alabama A&M University. She is licensed in Alabama and Tennessee with over 20 years of clinical experience. She has certifications in trauma, disaster mental health, and that I should have asked you how to pronounce this before we started. And Ethnology. She is presently a mental health counselor at Thrive, Alabama, a psychotherapist and clinical consultant in private practice, and an adjunct professor at Alabama A&M University in the Department of Social Work. Her focus of practice are with clients with issues related to trauma, grief, loss, domestic violence, sexual assault abuse, and chronic health. She is the past chairperson of the Alabama Board of Social Work Examiners, maintains several professional memberships, and strives to remain active in her community as a disaster mental health specialist with the American Red Cross and with the North Alabama Medical Reserve Corps. So thank you for joining us today. In addition to Ms. Claiborne, we also have Dr. Elisicia Jiles. She's a board certified family medicine physician and a Birmingham, Alabama native. Dr. Giles graduated from Florida State University and received her medical degree from the University of Alabama School of Medicine. She completed her residency with UAB Family Medicine Clinic here in Huntsville and has practiced medicine in the Air Force as well. Dr. Giles and her family have now settled in their new home in Madison, Alabama. She is married with one child and enjoys spending time with her husband and daughter. She also enjoys getting together with her dad, six siblings, and family. And of course, this was pre COVID. Prevention medicine is truly Dr. Giles' passion, helping people to be the best version of themselves by making their health a priority. She also enjoys exercising, reading various types of books, and has embarked on developing a green thumb. And she said this is her daughter's doing. So, welcome, Dr. Giles. Thank you. Last but definitely not least, we have Miss Tanisha Smith. She is a native of Huntsville, Alabama, with 18 years experience and of working in the mental health profession. Currently, she is the crisis counselor for Alabama A&M Health and Counseling Center. Ms. Smith is passionate regarding being an advocate for all people, especially students. It is Ms. Smith's goal to address issues regarding mental health disparities and help individuals heal from trauma. So welcome, welcome, welcome everybody. Again, thank you so much for coming on today. If you have any questions, please drop them in the Q&A and we will make sure, as Ms. Smith said, to get to your questions after we have our discussion. So to begin, I just want to go around and just ask everybody, how have you been doing since the pandemic? We started off around March 12th, going into safe at home, and then we've graduated into safer at home and doing 6 feet and hand washing and face coverings as well. But how have you all been doing since then up until now? And anybody can start.
Okay.
It's taken go ahead.
No, go ahead, Doc.
I mean, of course, it's taken some getting used to. I think it was like, yeah, this be over in a few months. We'll be back to normal. And here we are in July, and I'm like, oh my gosh, this is gonna drag on. So it's definitely taken some getting used to. Still don't even think I have a balance.
Right.
With the blend of working from home and having kiddo at home, and everything's blended, she thinks you're accessible, but you got to see your patient. So, but just like anything else, we can persevere. We just got to keep the goal in mind, and it is to protect others, not just yourself. It's not just about you. It's about protecting other people, our vulnerable population.
Absolutely.
I agree. I agree with what Dr. Giles said. At first, it started off as a very well-needed mental health break. Thought it would just, be for a couple weeks. Enjoyed the time to just catch up with my children and to just do things around the house and still be able to see our patients. Now it's a balancing act for sure. Never know what day of the week it is. Mm-hmm. And it's honestly, it makes you reflect on, do I leave the house? Do I not? Because you have to be so careful that you don't bring certain things home to your family, right, as well as expose other people. So it's one of those really awkward moments that I've been experiencing currently.
Absolutely. Let's see. I might be able to.
Thank you.
Yes.
It wasn't allowing me. I was trying. I agree with everyone on the panel. The theme for today is a very good thing, and I think it was, and it don't stop. I think that's what it's not ending. It's not ending, and I know we'll get into this later, but I feel a lot like my clients do at some points with what's next and not having answers. And I work from a place of planning. Can't plan. Because planning does nothing, because one week, one day, it's this way, and then the next day we're told it's something else. And so nothing's solid. And you do have to rely on a lot of whatever you have on the inside of you to have some stability so that you can continue to serve others. So I am with my sisters here in agreement, and we have to rely on each other for support. And I'm glad that you're doing this today, because maybe it'll help someone else to see that we're human. Just because we're professionals and that we're serving, we are human, and we're right in this same journey with everyone.
Absolutely. I totally agree with that. And everything that y'all have said, I feel, it's been a balancing act. Like Ms. Smith was saying in the beginning, I was like, oh, okay, I get to work from home. I've always wanted to try to work from home. So I get to work from home. I was looking up all these recipes because I was like, now I have extra time to cook. I'm not stuck in traffic. And then after it was like the mid of April, I'm like, oh, okay, this isn't going away anytime soon. This is something that's going to be here for a while. And then like Dr. Jiles said, it's July. And so when this first happened, I was like, oh, early May, summer, we'll be fine. And I'm like, oh, it's July now. We're still going to be fine, but it's not going back to where I try not to say normal anymore, because I don't think it'll ever be what we had as normal, before, but it'll be like a new sense of calm, hopefully. I think it's what everybody's looking for. And with the title, it's like every month it seemed like something else happened, and then something else happened. And I was like, everything is continuing on, even though that we are dealing, with this national pandemic right now. And so I've been trying to think of ways to cope, just have good coping mechanisms, reading books or going for walks outside or binge watching my favorite shows on Netflix, and not getting sad when I'm like, well, they might not come back till 2022, but that's okay. That's okay. So how would you all define coping mechanisms for you, and what are some that you try to practice during this time?
Well, since I'm unmuted, I'll go first. I listen to my favorite music. I like to go back to a lot of old school music when things were normal.
Right.
When people could hug and could walk in the park without trying to breathe.
Exactly.
Through this. And I like to dance around the house. I dance like nobody's watching, and if somebody's watching, oh well.
Right.
I do like to read. Also, when I can, catch up on some reading that I just kept putting off. And then the binge watching thing too. Prayer and meditation. I have to stay grounded. And that's just some of the things I try to do.
Just to piggyback off what Ms. Sophia was saying, definitely found that trying to establish a routine where I am getting into the Word, reading scriptures, doing devotionals, I feel like have been a grounding piece during a lot of this, and a lot of the stuff that's been going on amongst the COVID pandemic. I really like to work out. It is my favorite de-stressing thing to do, particularly running. And I've definitely had the opportunity to do that a little bit more than what I was before. So also reading. My sister actually just released a book, and so I think I'm gonna stop what I'm already reading.
Right.
Because that's my sister, right? So, but getting an opportunity to get back into reading for fun, as you know, as professionals, I mean, you have to constantly read on the latest updates and all this other stuff, and it gets exhausting. It almost pulls away your love for it. So I'm trying to rekindle that since we have some time.
Right.
Yes, they've summed it up. I love what Dr. Jiles just said about getting back to yourself in regards to having a good time, having fun. I've been reading just things that I enjoy to read. You know, some of my favorite authors I've caught up and read series that they've written to escape the madness. So that's been very helpful. Just even taking evening walks with my children, something that we haven't done in a very long time. It's been something that has been fulfilling for the entire family. They look forward to it. And as Sophia said, dancing. Although my daughter, she won't allow me in her TikTok. However, I still, will photobomb from time to time. But yeah, just trying to laugh. Everything is so serious, which it should be, because the topics that are going on right now in the world, they're very serious topics.
Right.
But you got to remember, laughter is some of the best medicine. So I try to laugh as often as possible.
Absolutely. I try to find things on TV that I don't have to think critically about. I can just watch and it will just make me, bust out laughing. And then, like you said, having those moments to kind of meditate, go outside and like ground yourself and just remember like who you are. And, for people who practice religion, like whose you are, to just know that like, yes, I live here in Alabama, but I'm a human being and there are other human beings that are going through the same thing that I'm going through across the world. And like you said, we're all in this together. It takes, 6 feet, some hand sanitizer, a couple of washes of your hand, and a face covering to get, to be able to get through this. And at the end of the day, if we remember that we're all working towards a common goal, we'll be able to get through this, and we'll come out seeing, how resilient we are, how the things that really matter we still have, where, whether it's that close friends that are in your neighborhood or in your household, or you're able to talk to them from screen to screen. Like I've been telling my friends, I was like, I love you from my screen to your screen, because that's what we have, right now. And so doing those things have really helped. But I would be remiss to not bring up mental health, because when you look in the news, you see a lot of people are dealing with this and might not be dealing with it in the best ways. You might have some people who are misusing substances right now, or doing types of behaviors that they wouldn't necessarily do if they weren't under a pandemic. And so for both of you all who are mental health professionals and see people, what are some things that you have seen so far in regards to mental health and COVID-19? And what are some preventative methods that you would suggest to people who might be in a different mental state that they were in before COVID-19 happened? So gracious.
I know, isn't she a lady? A lot of individuals have reported depression, a lot of anxiety because of the fear of the unknown. Some substance abuse has been reported, well, overindulgence of substances, I should say. So as we meet with each other, we work on healthy coping skills, because I let them know that their feelings are valid. I don't try to redirect that emotion. Their emotions are valid to them, but it's up to us as professionals to help them engage into healthy coping skills,
right? So
that they won't, sink deeper in depression or even fantasize on suicidal thoughts. So it's very important not to take their emotions lightly or be like, oh, just get over it.
Right.
Because this is a very difficult time. Some individuals are isolated and they haven't been around any individuals. So that's enough to wear on anyone's mental. So just being empathetic. I think that's been my theme throughout this whole situation. You have to extend empathy.
Yes.
Absolutely.
And I totally agree with Tanisha with all of those things. And so I'll add to that, the social isolation is a big thing for some people. The introvert person you know, the introverted person is like, oh, this is working for me. You know, I can do this and I can probably do it a little bit longer. But then reality does kind of step in, because we're human beings and we need touch. And I mean, some people are not comfortable with touch, but some people truly need touch and to be in someone's face. I have a lot of clients who are tired of being in the same space with others. Their roommates, their significant others, their sweetie pies and their booze. They get to a place where they're about to pull their hair out. And I think that's where I'm seeing more intimate partner violence. And I almost have had to make some calls on suspected abuse of children and older adults, because they are exhausting each other's space. Enough already. Somebody needs to go to work. Somebody needs to go somewhere. Love my family, but.
Right.
Exactly. And then I'm seeing a lot of people not motivated to get up at all. For what? Why do I need to get up to do anything? And what I've suggested a lot of those times is to get a good sleep hygiene. You know, go ahead and continue to set a time between maybe 10:30 and 12 if you're a night owl, and make yourself have your body at rest. Even if you don't go to sleep, just put your body at rest so that you're getting some quality time with you. And then get up in the morning, bathe. You know how many people are not bathing right now? Right. I did a survey. Yes, bathe, nurture your body, nurture yourself, and treat yourself good. You know, this is a good time to try some things to spice up your face and some moisturizers and things like that. And so I just, I really look at a lot of those things to try to, and then develop boundaries within your home. So it's fine to be home with your children all day, but okay, mommy needs, let's play the quiet game, or let's see how long you can stay in your room, and then I'll be here. You know, so you make fun out of it. And even if you have a little money on the side, make it monetary. I'll give you $5, 15 minutes. You know, I don't know, whatever it takes, whatever it takes. I'm a little unorthodox, so y'all just have to work with me. But those are just some of the things. But the isolation seems to be one of the biggest. And that anxiety is no joke. When is this going to end? Nobody's watching the house, is what everybody keeps telling me. Who's in charge? In our workplaces, on the government level, and I'm not going to go into politics, but who's in charge? Nobody, it seems. Right. So, hope that answers.
Yes. Dr. Jiles, do you have anything you want to add? Okay.
Pretty much what they've already said, I've seen, except the part that Sophia was saying about the barriers. So that was a lot of food for thought for me. And I really appreciate that because I do have, you know, you can hear the frustration sometimes, and we talk about the coping mechanisms, but the way you put those ideas, I actually really appreciate that. And I'm going to take that and use that, because I'm an introvert and I'm one of those people that could probably do this for the rest of my life, like never leave the house, and then not realize I never left the house. But it is trying to empathize, like Tanisha said, try to put yourself in that person's shoes, in that position, so that you can connect with them and talk about the best way to cope. What both of you ladies said.
Yeah, and the isolation and the anxiety has been real, because at first I like to call myself a talkative introvert. So I really do like to talk to people and like be in people's face. But after so long, I'm like, I need to go home because it's been too much. It's been too much. But the first couple of weeks, I was like, I like being at home, but I also miss being around like 4 to 5 people in like a small group talking in person. But the anxiety, absolutely, for the 4th of July, you know, I decided to go to a fireworks show. And when I got out there, I was just like, oh, this is too much. Like, it is way too many people out here. And in my mind, I'm like, if y'all would go home, we will be done sooner. So like, I had a whole situation. I'm having to check, myself. I'm like, okay, I understand people have been in their houses for all this time. They want to have a moment with fireworks, just like I wanted to have a moment with fireworks. And so I think giving yourself grace in those moments to be like you said, Miss Smith, your feelings are absolutely valid. Everything that you are feeling right now, it is perfectly fine. Like, it is okay to not be okay at this time, because I don't think any of us would have thought when we were celebrating New Year's Eve that in March we would be faced with a global pandemic. And a lot of people, like you said, Sophia, it's like, who's driving this ship? Like, where is, what's going on? We're just trying to figure it out. And one of my friends was saying on Facebook, she's like, at this point, I'm tired of myself. I have been alone by myself so long. I'm tired of myself. But coming up with those good boundaries and be like, hey, now we have, cute little coworkers now that are at home with us at the same time. And it's like, if you go in your room, like you said, $5, $10. And then now when we get out of quarantine, you have a nice savings account for helping me out while, we working together. So that's all that we can do is continue to work together during this time. And so there are many things to remember. For example, like making sure you have your mask. One of my friends said she was halfway into the store and she's like, oh, I forgot my mask. And she felt like a superhero. Like, let me go hide my face so I can make sure I'm protecting myself and everyone else. But what are some other things that we should be remembering right now, especially when it comes to our overall physical health in regards to like primary care, and then for our kids and little cousins, pediatric care?
So, definitely just general care. We talk about mental. You got to keep the physical going too. A lot with this social isolation, you have to think about how little movement people are doing, and therefore you probably notice more aches, more pain just from the lack of movement. So you got to remember to move. Like as Sophia was saying about treating your body, just being physically active in some way, shape, or form is also a treatment for your body, for your joints, for your muscles. So just remember to do that and give yourself time every day to move. Also, eating. A lot of people eat their grief. One of those individuals. I will eat my stress. And so just be mindful of the things that you have around the house. Take this opportunity to make sure that you're eating healthy. You have healthy options around, and pay attention to what you're eating and when you're eating. A lot of people are noticing weight gain because of those two issues. And the last thing you want to do is just get to a level of decondition and weight gain that, once you get back to going out and about, you're like, man, I can't make that flight of stairs like I was before. And we do know that a lot of the chronic conditions or just deconditioning, these are the people that the virus is targeting. So these are the people that we're worried about. So make sure you're taking that time to stay up on that part of your health. And a lot of clinics have adjusted to this. Don't think you have to avoid your doctor's office. Like, oh, well, I don't need to make that diabetic appointment because COVID's happening. No, you still need to make sure you're taking care of your chronic conditions. Call them ahead of time. See what advice they have. I'm sure they have parameters in place. Go ahead and get that information ahead of time, but make your appointments and take your medicine. Did that answer the question?
It did. That was perfect and to the point. Especially like at the end, take your medicine. If you are on medication during this time, do not let that slack up, because that's going to cause more issues for you down the line. And a lot of pharmacies have been doing 90-day prescriptions, so you won't have to come to the pharmacy as often, and you won't have to have, that interaction and deal with anxiety with that, or like, oh, I don't feel like leaving the house. I haven't had to leave the house for like a week, so I really don't feel like leaving because now I'm used to that. Now you have different solutions to kind of deal with those barriers and that stress during this time. So yesterday, I was on Facebook and I watched how they had like the daily briefings from Madison County in regards to COVID-19. And one of the things that they were mentioning, it was like, if we can increase face coverings or mask wearing by 80%, 90% of the transmission rates will go down. What do you think are some issues for people for not wanting to wear a mask or wanting to but not being able to? What are some things that people could be going through during this time in regards to face coverings?
Well, one of the things I wanted to touch on and truly be kind to these individuals, as an advocate for individuals that have experienced sexual assault or domestic violence, the face covering is a trigger for a lot of them because it reminds them of a possible suffocation that they've experienced or just an attack. So that inability to breathe takes, just really could cause a severe anxiety attack. So I know that it's like right now it's all or nothing for a lot of individuals, but everyone you see that may not have a mask on, it may not just be straight defiance. It could possibly be that they have not been introduced to a face shield, because the face shield is something that is recommended for those individuals that have experienced sexual assault or domestic violence, because it's more open. Your face and your nose is not covered up too tightly. So that would be one of the things I wanted to touch on for those individuals that are survivors of those heinous acts.
Dr. Giles? Oh, okay. One of the things that I'm hearing in the therapy sessions is people are thinking that this is a conspiracy. So they are being defiant of the conspiracy. They feel, some people are saying that this is an opportunity to control the population. So they think that, so it's a tough spot, to be a therapist, and you want people to be where they are and let them be there, but you need to make sure that there's not some delusional kinds of things going on too, for different reasons. But they are also expressing that this is an attack on people of color, Black and brown people, because the news or the media is putting out there, that we're the ones who are being attacked the most. We're dying, and because of comorbidities and things like that. And so they don't want to wear the mask because they just don't believe that any of this is real. And then, of course, like I said, some of my political clients like to bring up that wearing the mask is not believing in their party. And if the leader of their party pretty much is saying that, and I'm treading water here very carefully, if the leader is not in agreement with taking care of themselves openly, then your followers are going to think it's okay as well. And so it's very difficult to get people to understand that this is not just about you. This is about humankind and taking care of each other. If you have any compassion, any empathy for people that you care about, when every time we go out, we may be bringing something back. And if you got people in your home that you do love and care about, you need to think about that, more than a political party or a conspiracy. So there's a lot that we have to dissect in the sessions to allow people to try to make sense of all of this, because it's going on. It's going on longer than they're able to handle and to cope. A lot of our coping mechanisms have a time period. I can do this for so long and then I'm not good. And so it's going on so long that it's affecting people's ability to function. And that's when I start talking to them about, maybe you want to look at some medication intervention. There's nothing wrong with that if you need it. I don't think that pills are the answer to all things, but sometimes you truly do need a little bit more to get over the hump. So there's a lot happening inside people's minds, and they're just trying to handle it.
Absolutely, for sure.
I just love when you talk because you give me some perspectives that I did not consider. So I'm just going to be honest. This is the teaching time for me too. I'm learning a lot just from the mental health aspect of some of this. And this is a time where you really do have to be selfless.
Yes.
Like you said, this is, people are taking this very personal. I know a lot of the young adults, hey, you're gonna ruin my summer break and I don't want that, so I'm gonna do what I want. But it's not about you. Sorry, dear, it's not about you. It's about the person next to you. It's about that, you know, you may have a little cough and not think much of it, but it's about that little old lady that's sitting there looking kind of frail. Or even your parents. It's about them. It's not about you. But medically, there are some conditions that can affect people wearing masks, and we have to keep that in mind too. Like, you know, if you have someone with significant COPD, putting a mask over their face when they're already struggling to just take that breath every time, that can be an issue. Congestive heart failure. Just good old asthma if it's flared up. Seasonal allergies. If you're congested, that by itself can make it difficult to just wear masks. But I do believe that if we all do our part for those sensitive patients who just cannot stand to wear it for long periods of time, we can protect them. We want them to protect themselves, but if it's a struggle, wear yours so that you can feel like you're protecting them as well.
Absolutely. And I just love the shared knowledge that we're all being able to receive right now. And Miss Smith, you brought up a really good point. That's something that I actually hadn't thought about, how depending on your life experiences, putting on a mask can be very traumatizing to you. And like Elisicia said, in regards to like racial tensions that are going on right now, because we also have COVID-19, but we also have increasing police brutality right now. And so some people, especially Black and brown people, might not feel comfortable wearing a mask for fear of being perceived as a threat walking down the street or anything like that. I mean, we have a case that happened in Colorado where Elijah Cummings had on a mask and then he was targeted and, unfortunately lost his life. And so a lot of people are dealing with, do I wear a mask to protect myself? Am I going to be perceived, in a different type of way? What are my options? And so knowing that, a face covering is a face covering. So if you have the ones that come up like a turtleneck, that can work. If you have a scarf, that can work. Like Ms. Smith said, if those don't work for you, you can wear a face shield. And it's not 100% compliant. So those 20%, as Dr. Jiles was saying, are for the people who have COPD or really chronic asthma or bad allergies where they can't, wear the mask. But, I ask you to kind of think about yourself and looking at millennials and I think, what is it, Gen Xers or Gen Zers, there's so many ones. I just remember mine. It's the early night. I just remembered mine. But, thinking about that, and my uncle always said, one day you will get old, God willing, you will get to that age. And so right now you might be this rambunctious young person, but that older lady that's to your right, when you're waiting on the bus or while you in restaurants or in the grocery store, you'll be that person. So think about being her age and hoping that someone younger than them would like, okay, I care about myself, but I care about the community as well. I'm going to wear a mask, or I'm not going to go to Miami for a weekend. I'm going to do something local with my friends where I'm not spreading something that I might not even feel that I have. Because now we're seeing asymptomatic cases where people feel nothing and then they're like, well, I'm going to get a test, and then now they're being diagnosed with COVID-19. So you all bring up very very good points in regards, and this is something that I've seen in some webinars and we've had discussions with my team. So like I said, I am the director of health education, and within health education we focus on chronic diseases, but we also focus on infectious disease. And one thing that has certainly not stopped during this pandemic is a well-known epidemic, the HIV epidemic. And this is something that we've talked about. And, you know, as HIV prevention specialists, we are like, I really hope people aren't having unprotected sex right now, because that would just, you know, that would throw another ball into the court and what we're trying to do right now. But to be honest and to know, just to know how everything works, having sex can be a coping mechanism for some people. And it depending on, it could be a positive one if it's with someone that you know, that you both know your status and you're using protection and everything like that. But it also can be a negative one, especially if you're misusing substances and you're not protecting yourself. And so that's something that has come up in a lot of webinars that we have been on in regards to having safe sex while also dealing with COVID-19. And so some of the things that, you know, we've talked about, like, of course, if you're kissing somebody, you can easily pass COVID-19 with kissing. So they're like, you know, if this is not someone that you are in the house with on a consistent basis, like if this isn't your partner or is a partner that you're always with, then, you know, not to really engage in kissing if you're trying, you know, trying to prevent the passing on of COVID-19. And so your safest sex partner during this time is yourself. And so how we talked in the beginning, you know, you're already getting to know yourself. You're getting to remember things like, oh, I really did like this author. Let me go back and find this book. Or I haven't seen this movie in 15 or 20 years. Sometimes the best person we need to be with is ourselves. And so also use this time to learn a little bit more about yourself. So, you know, when COVID-19 continues to go down and we're able to go back out, you can be like, okay, I am an individual who knows what they want, and I can tell you that, and we can have a great time together. And then, like I said, the next safest sex partner would be someone that has been in your home a consistent basis, whether that's your partner, you could have a roommate situation, whoever that is. If they've been there with you this whole time and they haven't been out, then that would be the next safest person. But in the HIV world, we talk about a lot of dating apps. And so during this time, that might not be the best way to date. I know some people who said they shut their accounts down. They're not on there right now. And they're just focusing on people that they have been consistent with that are in their household. And I was like, okay, that makes sense. And so there have been uptick in the beginning to a website called OnlyFans. And so a lot of people have been using that, especially if they were using sex for survival. They're now using OnlyFans to supplement their income during this time. And so, you know, you always want to remember to use condoms and dental dams and any types of prevention or barrier methods when you are having sex. But also remember your mask. And there are different types of positions that people can use during this time. Being very candid with y'all, missionary is probably not that position right now, especially with people having to wear their masks or not wearing their mask. So, you know, some professionals have suggested people to use different positions to make sure that you're keeping yourself as much as 6 feet as possible while you're also enjoying yourself if you have to right now. So this is much, you know, as much as we could do. We're dealing, you know, we're doing the best we can in prevention. At the end of the day, everything is risk reduction in regards to STIs, especially HIV. And even with COVID-19, the risk reduction techniques that we're using right now are wearing gloves and washing your hands and using hand sanitizer and wearing masks. And that's the same thing with STIs and sexual practices during this time. And if anybody on the panel, has any additional information that they would like to provide to that particular topic with safe sex during COVID-19, please feel free.
I think you covered it. I just want to say to the students that are accustomed to coming in and just getting the free supplies, set a budget. If there's not a local health department in your area where you can go and receive those tools that you need for free, just be very, very careful. Just because you have the desire and you don't have the protection, just think twice.
Absolutely. And we're doing everything we can out here as professionals to also prevent you from coming in contact with COVID-19 as well as HIV and other STIs. And as Thrive Alabama, we do offer free HIV testing. Right now, those services are not being used right now, but we are in the process of starting back up our HIV testing. So please be on the lookout for when that opens back up so that you can know your status, because you don't want to guess, you always want to know your status. Continuing on with our great conversation,
Oh, Brink, I'm sorry. I do want to
yeah.
say something.
Oh yeah, go ahead. Go ahead.
Sexual. There are several people who um, are involved in orgies in our area, and other sexual kind of parties. I do think that we need to listen to what you're saying. It's very critical because some of the things that you used to do, you just can't do right now.
Mhm.
And the COVID parties, I'm sure that you all have heard about COVID parties, but just in case you haven't, some of them have now become sexual or monetary. And so and the gist of it is you have someone who's positive with COVID-19 who arrives at the party, and the goal is, and everybody's putting money in, and then the person that can get COVID the fastest gets the pot.
Right.
Well, I just don't think that's, you get the pot and you also get the sickness and potential death and harming others. And so all of these risky behaviors, we just can't do what we used to do if that's something that we indulged in. I have to say that as seriously as possible, because in therapeutic situations, people share their deepest, darkest, what they other people may see as dirty. If that's just the way you enjoy your life, that's fine, but not right now. You got to find another way, because this is very serious. And that's all I wanted to say about that. I'm sorry.
And like we've been saying, this is a time to think of innovative new ways to do some of the things that you would do on a regular basis. And like Sophia was saying, there's some things that we can still do, but we have to make kind of like boundaries and concessions for. But there are some things that we just can't do, during this time. And it's not to say that we're trying to be mean, or like the country's like, well, you can't do this, and we're infringing on anybody's, civil rights or anything. But some things you just can't do right now. And at the end of the day, it's all in a greater good for everyone, not just for a particular group. So yeah, absolutely.
Thank you.
It's a great point, because when I seen in the news about the COVID-19 parties, and I was just like, this is it. I don't know what's going, I don't know what's going on. Because like you said, the biggest thing right now, and I think everybody's using, is like, oh, okay, so there's a mortality rate with COVID-19, but people aren't thinking about, like, okay, some people are getting COVID-19 and they're recovering, but there's so much we still don't know about COVID-19. So we don't even know, yes, okay, you survived, you live, but what other health issues are you going to have? Like, is this going to cause your lung capacity to be decreased by any type of percentage? Is this going to cause cardiovascular issues? Would this make people more prone to have blood clots because they're not able to get oxygen to their blood in a better way? Like, we don't know. It's so much, like I said, every week something changes with COVID-19. So just because you're in that age group where the mortality rate might not be as high, you still want to do everything you can to prevent yourself from even coming in contact with that particular virus. And she'll come back. She'll come back in. We lost Miss Smith, but that's okay. So, like I said, there are some things you want to remember in regards to infectious diseases like HIV and STIs, but also with chronic disease. What are some things to remember for those people who might be living with diabetes or high blood pressure, or just any other chronic disease? What are some things that they should remember during this time?
Well, number one, I would say to the group of people living with some type of chronic disease, we're doing a lot of the preventative measures for you. We need you to also take it seriously, because yes, the little kid with the runny nose may not seem that sick, and your grandkid is over for the weekend and they don't seem that sick. That doesn't mean that they're not sick and that they don't have COVID. And so even with your family, we need you to take precautions, because you are the person that we are worried about. If you get this disease, that you're going to end up in the hospital. and you could end up on a respirator. Just because of the way the virus works on the immune system and stresses the immune system out, you're already what we call sensitive, okay? So I need you to wear your mask. I need you to wash your hands consistently. And that's warm, soapy water for 20 seconds. Make sure you have some hand sanitizer. I know that the stores have been out. Get creative. Get you some rubbing alcohol, some aloe vera, mix it up. You can do it. But we need you to take it seriously too, because I've had patients with chronic conditions, and even on the video chats, I'm like, well, where's your mask? Because you're standing outside. And I don't know where outside you are, but I need you to go put it on. Also, get creative. Some of our older patients are not that tech savvy, but know that there's grocery pickup. Kroger is doing free grocery pickup. There's Walmart. Certain Publixes are starting to do grocery pickup. Utilize those resources to limit your exposure. Or if you just got to go in the store, shop when you know nobody else is going to be there. That may be 7 o'clock in the morning and you normally wake up at 11, but this time I need you to get up at 6:30 and get ready to head to the store, just because we got to keep you safe. And like I said earlier, take your medication. This is not the time to fall off of your visits. You need to try your best to make sure that everything is controlled, because when things are controlled, your body is not stressed out. You don't have your cortisol hormone doing damage to the body, and therefore is a breeding ground for the virus. Just really, I can't stress enough to take it seriously. I'm sorry. I'm just worried about those individuals that just don't think that it's going to affect them. And I had a patient recently who, he's sick, he is positive, and he go to the hospital, and he was not wanting to go.
Yeah.
Not denying going. And I'm just stressing, when you're sick like that, if you're having problems breathing, shortness of breath, you're feeling weak, you may not be running the fever. There are cases where it's just fatigue. Mm-hmm. Go to the hospital, get checked out. That is not a time to go through anybody's drive-through if you're at the point where you can't even just take care of yourself. You can't get out of the chair to walk to the next room. That's the time to just go to the ER. Okay, I know it's a stressful situation in regards to finances. I hear you, I understand. Nothing is worth your life.
Right.
Okay. So yes, so stay up on your labs, stay up on your doctor's appointments, take your medications. But also don't just assume because you do not have congestive heart failure, because you're 30-year-old or younger, that this won't affect you, because we have seen some interesting cases and where we're looking at that individual and we can't really explain why they were found dead and they're positive for COVID. Mm-hmm. They may be a little obese. They may have been just a smoker, but there are cases out there that just don't fit the typical. You do not want to chance it and be one of those cases. Take it seriously.
Absolutely. Absolutely. And I think, for me, I know, especially in the beginning, like I was in denial, because I remember when it first got to California and Seattle, and I was like, oh, okay, it's the problem, but it's probably not going to come, on this side. I'm thinking that the United States is so big where, it's not going to make it to this side of, my side of the States. And so when it got to Alabama, I was like, okay, this is a problem. And I think some people might be in denial where they're like, I might have, a little shortness of breath. I'm not really hot, but I'm kind of sweaty, but I don't, might be having some symptoms, but don't want to accept that they're having symptoms. And so like going to the doctor's office for them would be like, oh, wow, like there really is a pandemic going on. I could potentially be one of those people in those numbers that they're reporting on, at 5 o'clock every day. And so it's like, you have those moments where you don't want to believe that this is happening. But like Dr. Jiles said, we have to take it serious. And even for, the conspiracy theories that we have right here, you might not believe that this virus is actually here, but you can look at the numbers and tell that it is actually here. And, I might not be able to sway you that it's an actual virus, but just wear the mask anyway. Like, find a cute mask for you that will go with your outfit and just make it a new accessory until the virus that you might not believe is true goes away. Like, just wear a mask, find your cute little, head shield, bedazzle it, do something, anything to still make sure that you're trying as much as you can, to comply. How long can I sit around someone for 6 feet and, try make a game out of it? Like, okay, I've been 6 feet for the last 5 hours with this person. So I'm, do, like you said, do something to make sure that you're taking it serious, that you understand that 6 feet is what we're striving for, and wearing a mask as much as you can when you're out in public is what we're striving for. To understand that this is a big deal, and this is serious, because the people who have lost someone to COVID, or who could be going through COVID right now, it's serious for them. And so sometimes I feel like in society we don't believe something is real until someone like comes and taps us on the shoulder. But let this not be one of those times in history where we have to wait until something is at our door to believe that it's true. Let us believe it, because we have professionals that are saying it, we have celebrities that are saying it, and we have people that look like you and I that are experiencing this right now. So absolutely. Thank you so much, Dr. Jiles, for that. So we have a question in the comments that's like, with everything going on in the world, how do we keep hope? Like, first it was April, then it was May, then it was June, now it's the end of July. How do we keep hope during this time? And so I want us to end on a high note. And we've had a couple of holidays that we've gone through, especially with the summer months. People want to get out, people want to do things, but what are some things that you all can suggest that people can do to still keep their spirits up, to still be hopeful in everything that's going on in the world, and have a good time while still physically distancing, practicing, wearing masks and things like that?
Okay, you can start new traditions with your family. Some in-home things. Two of our students, they have their own company, Paint the Trap, where they have a paint party on this Saturday. However, I'm sure if you reach out to those young ladies, they'd be more than happy to allow you to purchase kits where they don't even have to come into your home.
Absolutely.
So starting new traditions with your family. If you're a person of faith, your faith is very important right now. It's okay to unplug. I think that's the piece that some people are missing. You don't have to catch every single news report, because it's, although of course the data is going to be different from day to day, but learn to unplug. That's one of the things I really want to stress for those that may be losing hope. I understand it. You're not wrong in feeling the way that you feel. Do things that bring you joy, that bring you laughter. One of the things I know Dr. Anasori in the chat earlier had said, self-care is essential. Self-care is actually mandatory. We do everything else. We make sure we get up and brush our teeth, wash our face, take a shower, we eat. Self-care is 24 hours in a day. Don't say you don't have the time, because guess what? You can accomplish all these goals, but if you are not here to enjoy them, then what? Exactly. Learn to take a mental break. Know when to say no. If you have family members that continuously want to invite you over to things, no, it's okay. No is a safe word right now. If you are someone that is, this has you in a very bad place, it's okay to tell people no and to take care of you and yours. And in order to take care of your family, your spouses, your children, elderly parents, you have to be well. I don't know how many times we can stress that to you, but find those things that bring you joy. And as Sophia said it earlier, some coping mechanisms, they have an expiration. You can't do the same thing over and over. I know my people get sick and tired of me. Insanity is a quote I probably say 1,000 times a day. My kids could write a book about it. If it's not working, try something different. And it's okay not to be okay. Regroup. You got another 24 hours the very next day.
Absolutely. Okay. I was gonna see if y'all had anything else to say.
Well, I was just gonna say, I think I was watching something on the news recently where, and I agree totally with Tanisha. She hit all of the points, but sometimes we can't actually use social media for some good connections. They were talking about COVID buddies, where people are isolated, but they're getting connected with other people who are isolated that are not seeking any sexual connections or dating or anything like that, just solely for companionship, maybe a little accountability. You know, you good, I'm good. Checking in with somebody and developing some relationships that way. I think that that's one thing that you can also do. And I've I use some of the grief models to try to help people deal with, because this is about loss to a lot of people. This loss is so significant that it brings on the thoughts of other losses, and so it's like they're stacking. And so there's a model, I can't remember who created the model, I think it's Wharton, but it's called the tier model. And the T is like to accept the loss, accept the fact that we are dealing with something that we've never dealt with in a lifetime. There's nothing we can do about it. The E, oh gosh, did I write it down? Experience it. Experience everything that you're feeling. Like Tanisha said, what you're feeling is valid. Your feeling is your feeling. Nobody can tell you that you're not scared, or that this is uncomfortable, or that I'm experiencing some real anxiety. The A, adjust to the environment as it is. That might mean making some changes. Like Tanisha said, do something different than you've done before. And then the R is just reinvesting. Reinvest in whatever the new normal is going to be. And so I think Dr. Jiles even said earlier, on the other side of this is going to be something. They were talking about how the schools are going to have to, it's probably going to take a couple of years before the educational outcomes are going to get back to some level. And our bodies, yes, that COVID-15 and 20 and 25 for some of us, we're going to have to go back to the gym and go back to doing some of the things and cutting back from the table, doing the things that we used to do. And the people that we missed hugging, at some point, maybe we'll be able to hug again. Put that in your queue. Hey, I'm gonna be able to go hug my auntie as soon as possible. Because she's 78 and I don't want to go around her right now. I'm sending her hugs through the screen, but she's gonna be one of the first people I go to and give some love, because I need that auntie hug. So it's not hopeless. Totally, it may feel that way, but I think talking to not only a therapist, but maybe a trusted friend, somebody who's positive, have a positive circle around you. As soon as you start hearing negative energy from people, those are not the people that you want to spend time with. Later for you. I don't have time for that. And I love you, bye. It's okay to not have those conversations with those people. You see them coming, I already have a strategy. I help people talk about strategies for communicating with certain people. If you don't want to deal with somebody, then there's a way to talk to them so that you get control of the conversation and you take care of you. Because there's only one you. You got one time to do this life thing. And so that's all I have. That's all.
That was great.
Just continue. That was perfect. And I love that acronym. That was wonderful. You pretty much said what I was going to say about the positivity. Like whatever you're doing to try to cope, make sure it's going to breathe positivity into your life, because negativity is heavy. It weighs you down. And there's no reason to dwell on whether or not it's a conspiracy. Did they bring it here. You know, is this a way to control the population? It's just no reason to even go there, because when you have that thought, what are you going to do with it? Is there an action behind that? No, it's just going to take energy from you. So just make sure you're breathing positivity back into yourself and explore new things. You probably never thought that you would be good at yoga. Give it a try. See what that would do. Or just meditation. Get creative, but just make sure it's positive.
Absolutely. You all bring up very good points. Very good points. And that positivity is something that will keep you going. I seen something on Facebook where it was saying that when you're having negative thoughts and you're trying to be productive, it's like a barrier in front of you. Like you just can't get around it and you're just trying to crawl over it and everything, and it's just not working. But when you have a mindset of gratitude and you think about even the small things, like you might see the sun rise and that might be the only positive thing that you can think of that day, but focus on that, and that can help you to be more productive if you're in the workforce, or just to help you to see that every day a sun is going to rise and something is going to change, and eventually, it will get better. But making sure that you have that moment. I remember when my mom was going through breast cancer, she said she would allow herself an hour a day, kick, scream, yell, to do whatever she needed to do to get all of that out. And then after that, she was like, I have my hour. This is my boundary. And now I'm going to pick myself up and I'm going to keep going on. So if that is something that you need to do, because like we said, your feelings are valid. It's okay not to be okay during this time. Don't let that consume your entire day. You know what I mean? Because like a fire without boundaries, it will get over everything. But if you contain that fire, it'll be in that little container, and you can open it up if you need to, and you can keep it closed, and you can keep on moving. And so trying new things, like Miss Smith said, if one thing doesn't work, try something else. For me, at first I was cooking, I got tired of cooking, so then I started watching TV shows. Then I got tired of watching TV, so then I started reading. I got tired of reading, I went outside. And then I'm like, okay, well, this time I'm gonna pick this type of book, and then I might want to read this one, and then I'm gonna try a different show. So continue to try different things and have that positive buddy. Sometimes you don't want to hear positivity, but if you don't receive it in that moment, you remember it later, and it will still help pick you up during that time. Some additional things that you can do, like Ms. Smith said, the paint parties. I've seen numerous ads on social media about we'll deliver the stencils to your house and everything. You can call us through Zoom and I'll paint with you, and we can have the paint party virtually. Most definitely do that. I've done scavenger hunts with my friends. We've had happy hours and birthdays, because birthdays are still happening. Weddings are still happening. All these events are still going on. And so being resourceful and being innovative and be like, okay, if they can't be here right beside me, I'm going to call them. We're going to do it together. And so remember that you have options. You have ways that you can do this. If you don't have access to a computer, we have cell phones or a landline. Call the people that you haven't talked to in a while, especially if you haven't talked to them in a while, because they probably don't have anybody to talk to either. So remember those folks that you haven't talked to in 3 or 4, 6 months, however long. I made it to where, because I have a lot of friends, so I was like, okay, I'm gonna make a schedule. I'm gonna call this person today, and I'm gonna check on them, and I'm gonna make sure that I don't forget anybody, because it's 24 hours in a day. But if we get caught up in so many things, we'll forget the things that really matter, which are people, and just being grounded with the folks that you love, and just remembering the things that matter the most. And so just remember those things. Zooming with friends, reading a book, go outside and sing. Even if you don't sing well, sing your favorite song. Whatever it is that you can do to add happiness to this time, most definitely do that. You still deserve to be happy. You deserve joy. You deserve all those things. So don't forget that during this time. Again, thank you all so much for this amazing panel. I have learned so much. This has brought my spirits up, because hey, we're professionals, but we get down too. We feel it just like y'all feel it. So I'm right here with y'all. But I want to go ahead and open up the chat and the Q&A for questions, and we can do that, and we can wrap everything up.
Before we do that, I'm sorry, Obrenka, I have to go.
Okay.
I have some patients. So thank you guys so much for having me. I will check on this on Facebook later, and if there's any questions or something that I could add to, I will. But thank you, ladies.
Thank you so much.
Thank you so
Wonderful.
much.
Okay.
Talk to you soon.
Okay. Bye-bye.
So we have a question in the comments already. And so it says, do you feel that people have forgotten about COVID with all the protesting that has been going on in the world? And I have a lot to say about this, but I will open it up to the panel first. Okay. um,
Oh,
yeah, go ahead.
okay. I don't think that people have forgotten about it. I think that it was just such an emotional time for our entire country that individuals just wanted to do something. They needed their voices to be heard. So in their minds, that is one of the reasons they got out and beat the concrete.
Right.
So I don't think that they've forgotten about it. I think that it was just one of those moments, even if it was risky, that individuals just needed to do so that voices could be heard on matters that are extremely important.
Absolutely. And when everything started happening, I was like, oh wow, okay, so this is, it never went away, it's still here. It made me think of the social determinants of health. So as some of you all may know, I'm a public health practitioner. I love public health, everything about it. And looking at the social determinants of health is where we eat, pray, love, work, wherever we are, those are our social determinants. And so looking at COVID and then also seeing police brutality is it brings in how you have multiple social determinants affecting you when you're trying to have your best health outcomes. And so for some people, it might be where you have to decide between, paying this bill or paying your therapist or buying groceries or your prescription. And so in this instance, it was, do I protect myself from COVID-19 or do I go out and protest, especially as a Black woman, do I go out and protest because my life is also being affected by another thing that we deal with in America, which is racism. It has not gone anywhere during COVID-19. If anything, COVID-19 has kind of, exacerbated a lot of issues that we're dealing with right now. And so I don't think people forgot about COVID-19 when they were protesting, because I was so happy to see people with their masks on. Some people had sunglasses or goggles. People were still trying to protect themselves and be responsible citizens at the same time protesting a cause that they felt like was important. Because yes, COVID-19 can affect my life, but also police brutality can affect my life. And people seeing that even if they weren't a part of the group that felt like they were being affected by it the most, they were still out there in solidarity. And so I think people most definitely remember, and they were doing kind of like one of my best friends always says, they were doing the best they could with what they had. And so at that moment, they had gloves, masks, and hand sanitizer and their signs at the same time to make a statement to let people know that, we're afraid of COVID-19 and we're trying to prevent it, but we also are not going to stand for the injustices that are continuing throughout this society. So absolutely. Absolutely. I will sit up here and talk about that with y'all all day. Let's see what other questions we have. Let's see. Okay, we have some people saying thank you, very useful information. Um, Brandon is keeping our chats pumped up and everybody. So let's see. We have any questions? Currently don't have any questions. Please feel free to drop any in the comments or in the chat right now. Okay, let's see. I'm sorry. How do you believe COVID-19 will affect the mental health field in the future?
Okay, so for sure, telehealth or telemental health is going to be a mainstay. I believe at this point, where some people had thought, oh, I never want to do that. I don't want to be on a screen and I can't get that feeling. I think I have people now saying, I'm good to stay home and continue therapy here on out. Can we keep it this way, Ms. Claiborne? I think that's going to be, like I said, a mainstay. And I think they're already in the schools, in the graduate schools, using that as part of the curriculum. I know I'm helping the Department of Social Work with some of their curricula in some of their classes. And so I know that it's coming. Also, LPCs and social workers are going to be in demand, I believe, in more venues than what we've had before. I know that the police department is starting to incorporate more of that, not necessarily Huntsville. I'm not sure about Huntsville's, that we already have something in place. But I know a lot of the other police departments are now saying that they want social workers riding along with the police, because they need some people there that can, it's almost like an interpretation to interpret the mental health piece, because sometimes people don't need to be locked up more than they need to be looked at. You know, you need to be able to see people so that you can see what their needs are versus, putting them away somewhere. It might have been something underlying that was really going on that caused them to lose control, but maybe, maybe we can intervene. So I know that it's going to be much needed. And I think people respect it differently now too, because we're all going through this. Mm-hmm. There's not, I sit here feeling this way as a professional. LeBron James is at home with his kids. I don't know, name some people. Everybody's at home. Right. I bring up LeBron James because my son is, yeah. So just know that mental health is here to stay. And if nobody ever thought, even with the school shootings and all the stuff that we've had, people have not focused on mental health nearly as much as they have now, because people are feeling this.
Absolutely.
That was brilliant. Everything that you said, I agree with. I think that the profession will be respected a whole lot more, because America, for whatever reason, has become a reactive society as opposed to being proactive about things. So hopefully those individuals that were apprehensive about walking into an office to receive therapy services will feel more comfortable in the comfort of their own home.
Absolutely. That was something that I was glad that came around with COVID-19. Has been, some positive things, and that's been the use of telehealth for teletherapy. Teleprep for people who are taking that medication to prevent them from coming in contact with the HIV virus. For everything, you have telefitness. People are watching videos and doing Zumba virtually, and so all these great things. And like you said, bringing social workers on with police officers to help them see people, because sometimes it's not that, oh, I'm trying to perform this criminal act, but someone needs to see me. Someone needs to hear what I'm going through. I need someone to just care, to just see where I'm at, to understand where I'm coming from. And I'm not trying to harm you, but I'm also dealing with some mental health issues that need to be addressed before you de-escalate in the way that's going to be traumatizing to me. Because when you see a person, you don't know what trauma they've been through. You don't know what happened to them that morning. You don't have any idea. And so I think communication could be, a key in that instance. And it does bring back what is the word? Just people knowing that social work is a credible, and like mental health is a credible thing to do and to put focus and funds on, because we have seen across the United States so many mental health agencies and programs have been funded, and people are like, oh, well, mental health, you can pull your own self up by your bootstraps and you'll be fine. And it's like, no, we need these professionals to help us with these things. Even if you feel like, oh, well, I haven't been through a traumatic experience, but you might be having issues on your job, or you might have a new relationship that you're trying to deal with. And these social workers and therapists are integral to where our new normal might be at in the future. So absolutely. Let's see. Do you feel that this will be our new normal, or do you believe that things will go back to what we used to be? Yeah, I say no. I don't think things will go back to where they used to be. I think this is a moment of evolution for everyone. Things will most definitely be different. And for me, I had to think of like, things will be different, but that doesn't mean that different is bad or different is negative. I've probably said innovation like 20 times since we've been on this call. This gives you the moment to be innovative, to lean back on your resiliency as a person and in your community, and to come up with new things that you can do in this, this new world of things that we're having to deal with right now. So yeah.
I was gonna say yes, forever different. I don't think that, I don't even know if we remember what it was.
Right.
It's been so long now. I joke with my family and friends and say, oh, a hug. yeah, we used to, back in the day, that was something that we did. You know, and it's funny, but it's not, because this, you know, so I know people are telling me I will never party the same. I will never engage in, you know, conferences are something that I love to do, in-person conferences and travel. The last time I went to a hotel, it was already, you know, other stuff going on, and I'm looking at the beds and I'm checking around, and it was more stressful to be away than if I had stayed home. Mm-hmm. So now, I don't know if y'all been in a room lately with anybody, but if somebody coughs or sneezes, ooh, it's like, wait. You know, and maybe you just actually, but droplets. We're told that droplets are staying in the air for a certain period of time. Who do we believe? What do we know to do? I'm listening to the professionals on the news. That's all I know to do. Absolutely. And the professionals in our community. Mm-hmm. That's all I know to do. Going forward, I really truly don't think that there's gonna be going back. There's no going back after this. There are so many people that are feeling traumatized, by this situation, that we may have post-traumatic stress disorder diagnoses as a result of this pandemic, because the trauma is happening now in so many different ways. Absolutely. Yeah.
Okay, and we have another question that says, what are your thoughts on the vaccine? Now everyone gets the flu shots, so do you think that this vaccine will be the same? I will let y'all go first.
Well, you would ask that when our doctor gets off of the call,
right?
but with anything, people don't like being told what to do. So I don't think it will be a large number of individuals that receive the vaccine, because of the fact that it's new. Not enough research has been done on it. So it's almost like some of the feedback I've seen on the different news stories about it, they will say, okay, you frontline people that are telling us to get it, y'all go first. We'll watch and see. We'll wait. So I think it will be, a lot of individuals will be reluctant to do that, because the same with the flu shot. You know, a lot of people say, well, I don't get it because it makes me sick, or I just don't believe, I believe they give it to you when you get the flu shot. I think it will be no different with this new vaccine.
Yeah, I feel the same way too. I think some people, you always have people who will be skeptical to get any new thing. They're those people that research everything to the umpteenth degree. They're like, well, let me make sure. And they're like, okay, what is this inside this? So I can know, like, what type of needle are you using? Like, all these things. And so I think for our researchers, for the people who are working on a vaccine, right alongside, they also need to have, you know, a very effective treatment to go along the same side, because some people aren't going to, like, we know people don't get the flu shot, so some people aren't going to get this vaccine, and you're still going to have some type of treatment for people to also use, so that they can make what they feel like is the best health decision for them. Like, we have to meet people, you know, where they are. Some people would want a perfect world where everybody would get vaccinated and we wouldn't have to have, like, oh, I'll give you a free bottle of wine or a $10 gift card to get a flu shot. You know, some people would want that, but that's just not where we are right now. So most definitely have to think about other alternatives to vaccines as well as treatment during this time. Let's see. Any more questions? I think we are out of questions. If you have a question, please feel free to put it, drop it in the chat. If not, we will go ahead and wrap up. Again, thank you both, and thank you, Dr. Jiles from the internet, if you can hear us, for participating. If you have any last thoughts or words of hope or wisdom for our listeners, please feel free.
Well, one of the things that Elisicia had touched on about, you know, social workers and LPCs being more utilized, for those individuals that may not know, many years ago, Judge Sybil Cleveland had implemented mental health court, where Tammy Lee, who is an LPC, was the very first liaison for Mental Health Center Madison County, now known as Wellstone, that there are resources out there if you have family members that are in the judicial system facing long-term prison sentences, that there are resources out there for individuals that already suffer from mental illness. So I just want to give that plug because I didn't get a chance to say that. It just came to me. But what I want to leave with our audience, you all are amazing. You are loved. You are beautiful. We care about you. We do this work because we love people. We want to empower everywhere we go. If you're feeling hopeless, just know that someone cares for you. Don't feel like you're in this thing all alone. Reach out. This live video will be posted to our Facebook page, Thrive Facebook page, our individual Facebook pages. If you need to reach out, we can connect you with the persons that you would need to see. I don't want you all to lose hope, because I know it is frustrating. I know you're tired of doing the same things over and over again. Just know that there's always, wherever there's breath in our bodies, there's hope.
Yes, well said, Tanisha. I'd also like to piggyback on that to say you are not alone in this COVID situation. Don't sit by and think you can't reach out. No question is a dumb question or not a smart question. Ask, call the university, health center, call Thrive, call the local mental health center, which is Wellstone. Reach out to someone. If you're scared to do it, connect with someone that you trust and get them to help you, sit there with you to make the call. And then my last thing I want to say is I'm a strong believer in what you feed grows. If you feed negativity, then you yield negativity, negative energy, hopelessness, helplessness. Feeding positivity is going to yield positive energy. Stay around positive people. Again, I can't stress that enough, because someone can drain you with a text message and mess up your whole day. You cannot allow that to happen. Shut it down, shut it off. Kill people with kindness, because most people can't stay around it if they're messy. And so I just say, continue to love yourselves. And like Tanisha said, know that you are valuable, that you are worth it. And you are, you deserve the best life. That's it.
Thank you both so much. Like they said, everybody just keep pressing to that next moment. If you can't make it just keep pressing towards those 5 minutes, because that 5 minutes will make an hour, will make a couple of hours, will then make it to a whole nother day. And that next day might be your breakthrough. That could be, you might see a vaccine come out that day. Anything, that next day can always be more than what that day that you feel like that you just can't make it in. So like they said, remember that you are valuable, you are worth it, and you deserve it. And so we are here for you, like they said. If you need any type of mental health services, we do provide mental health services here at Thrive, Alabama, as well as Wellstone. If you know someone in your community that has mental health services, like Sophia said, find a buddy. If you don't feel comfortable reaching out to them on your own, have someone help you reach out to them. But don't sit there and be silent and be alone, because there are people like the three of us and like Dr. Jiles that are waiting on you to reach out to us. We want to help. We want to pour into you, because this is why we do it. We do it for other people. We do it so that we can see other people have the best health outcome, get to that next day and to that next day and fulfill their purpose and everything. So just know that we are here for you, and we love you guys from our screen to yours. And make sure to be on the lookout on Alabama A&M Student Health and Counseling page, as well as Thrive's page. For in 2 weeks, we will be starting the Thrive into Wellness Thrive Thursdays. And we will be having some Zumba instructors as well as yoga, some boxing, and even some hip hop dance so that you can come in for an hour, lay everything aside, and just enjoy yourself and have fun. So you can sing while you do Zumba. You can meditate while you're doing yoga just to center yourself. But make sure just to tune in, and we'll be here at the same time on Thursdays from 12 to 1 o'clock. And thank you all for attending. Yay.
Thank you all.
Bye, everybody.
Bye. See.